Welcome to the MRO Exchange, Connecting Healthcare Executives, your go-to podcast for staying informed in the dynamic healthcare world, where MRO discusses industry trends and topics with prominent healthcare leaders. In each episode, we delve into the intricate landscape of the U.S. healthcare system, shining a light on the immense responsibility shouldered by providers to effectively acquire, manage, and share clinical data with data consumers. Join MRO experts and healthcare executives as they navigate the important dynamics within this highly complex environment. From the surge in healthcare ecosystem demands to the influx of structured and unstructured data scattered across diverse systems, along with the ever-growing compliance, security, and privacy expectations, the MRO Exchange, Connecting Healthcare Executives, unravels it all for you. Tune in for a comprehensive exploration of the pressing issues shaping the healthcare industry today.
Well, good afternoon, everybody. Today is Friday, July 19th. I think we're going to start off and memorialize this day a little bit, since it is the day of the CrowdStrike error and the day the world stood still for a little bit. But anyways, my name is Angela Rose. So thanks for tuning into The Exchange, where we connect healthcare executives together in various topics of discussions. You can learn more about me and my background on MRO's website at mrocorp.com. And I'm happy to connect with you on LinkedIn. If you just search for my name under Angela Rose at MRO Corp, I would love to connect with you. Today, I'm here to connect you with Jami Woebkenberg. She is the Senior Director of HIMS Operations at Banner Health, and she's also a friend of mine. And we're going to be discussing all things automation in the health information management world, or as us HIM professionals like to call it, just HIM for short. Jami has been a part of Banner for over 20 years. She secretly asked me before we started to tape this session we don't need to discuss how long neither her or I have been in healthcare in total, but she has served she serves on Arizona's HIM board of directors in various roles. She is now currently serving as the president-elect for not the first, not the second, you guessed it, third time's the charm, her as president-elect. So congratulations on your recent win, Jami. She was most recently awarded with the Lifetime Achievement Award by the Arizona HIM Association at their annual conference earlier this year. Another congratulations to you, Jami. She has also served as volunteer with AHIMA, recently coming off of the board of directors a couple years ago. She serves on numerous practice councils, writing articles, practice briefs. She currently sits on Leader Advisory Council and a Governance Agility Task Force for AHIMA, as well as Fellowship Committee, and is a mentor like me for AHIMA. Our paths cross quite a bit, which I'm always happy to share with Jami. So welcome, Jami, to today's episode of The Exchange.
Thank you, Angela. It's a pleasure to join you today, as well as your listeners, and also a pleasure to take a little break from maybe the chaos of the day and what we're experiencing.
Yeah, I don't know that all of us had a choice of taking a break or not. I think some of us were forced into taking a break.
That's right. I agree.
So I know we wanted to discuss automation today since, it is a huge industry buzzword, right? And not necessarily just our industry, but today we're going to focus on health information management. And it has been quite a buzzword for quite a few years now. And the future of it really depends on some of the strategic decisions and the strategic initiatives that happen, and whether, we're successfully implementing the technologies that we need to drive the optimal outcomes, for patients, for just organizations and our healthcare organizations in general, and really at the end of the day, achieve our financial goals. Health systems, as we all know, they struggle with inadequate infrastructure to handle surge of medical requests that can come in. And then you're exacerbated on top of that by all of the stringent regulations that come out. Substance use disorder and reproductive health both came out in a matter of months in the same year. So, lucky we're not talking about that today, because that'll be a whole own episode. But let's dive into your experience, Jami, that I want to kind of understand and hear more about your experiences. Banner Health has been in the midst of, I know, a lot of different automation and pretty much like an overhaul, if you will, to address some of your inefficiencies in your department, in the health information department. So I know you recently began automating the retrieval of medical records. And I know you have a bunch of other automation efforts underway as well. what drivers, like what criteria do you look for, or do you consider when you're making a decision to implement, something like auto retrieval or any type of automation, really?
Angela, I'm going to start out by telling you a little bit more about Banner Health first, and then we'll get into some of those drivers that were in our decision to implement more of that automation and specifically some of the auto retrieval here at Banner. So first of all, we're one of the largest private not-for-profit integrated delivery networks in the United States. Banner Health has an annual net revenue around $14 billion. Our corporate offices are located in Phoenix, Arizona, and we provide services in 6 different states, which include Arizona, Colorado, Wyoming, Nebraska, Nevada, and California. We provide numerous services, including acute, urgent care, ambulatory, medical imaging, home health, and post-acute services. We also have an insurance plan and network division, and we have several other joint ventures that I won't cover on this podcast today. We have over 55,000 employees, and my team for health information management operations is comprised of roughly 400 employees. I also want to point out that Banner has been recognized this year as a most innovative company by Fortune. We were one of 21 health systems on that list, so very exciting for us. We were also listed as a most trustworthy company by Newsweek, and we were one of the top 150 places to work in healthcare by Becker's Hospital Review. So again, just a few of the accolades that Banner has recognized so far this year. To cover a little bit more specifically about some of the drivers that were behind our decision to implement auto retrieval here at Banner related to our medical record request, we continue to see a volume of requests for medical records continue to rise. I don't think we're different than any other healthcare system in seeing those volumes increase. And I think a lot of that has to do with that increased focus on value-based care, as well as still coming out of, COVID and that pandemic and seeing some of the requests that were maybe related to everything that was going on during that time. Like many other organizations, not just in healthcare, but across the nation, we still see challenges in workforce staffing, and we're still looking at ways to overcome some of those challenges. We've also been on a multi-year journey to modernize our processes and workflows for release of information. We've done this in other rev cycle departments over probably the last 5 to 6 years. We were lagging a little bit behind in the release of information space, so we were very happy to partner with MRO about 3 years ago. I think we're coming up on our 3-year anniversary pretty soon, and look at how we can modernize those processes and workflows for release of information. All of this aligns with our culture of innovation here at Banner Health. So getting back more to specifically release of information and that auto-assisted logging and auto-retrieval process, when I considered how we could best meet the challenges that we're facing, partnering with MRO to implement auto-retrieval and auto-assisted logging made logical sense. With the auto-retrieval process, we can provide records in a timely manner. We can ensure that we're compliant, and we can save the organization money by not requesting additional staff to process the work. So, even though we're focusing right now on auto retrieval for our HEDIS and risk adjustment request, I am looking at how we can also take that same technology forward into the future, and we can roll that into other request types that we may receive. And I'm going to talk a little bit more about the auto-assisted logging process a little bit later in the podcast, so we'll keep everybody's attention a little bit longer for that.
That's great to hear. And impressive, and congratulations on all the awards for Banner that you had mentioned earlier. That's great. And I know you, Jami, I know you are a big advocate when it comes to automation and technology and how can we take advantage of it, especially with all of the data that we have, that's electronic, that is existing in an electronic media now. So, when you talk about all of this, a project like this can be, it can be daunting for organizations. I think it's a large overhaul to take on, but there's also a lot of considerations, right? It's not just about taking the technology implementing it, making it come to life, making it usable, but, also having to think about the privacy and security protections of it. And, do we have the right safeguards in place if you're going in and pulling records out on, through automation. So if you could tell me, besides having to focus on, the day-to-day activities and stuff, or what the immediate goal all the automation is going to fulfill for you, what is the long-term strategy? What are your hopeful outcomes? Like, what do you, maybe your short-term and your long-term goals, a little bit of both. What are you hoping for, after all of this implementation is done?
Well, certainly short term, at least being able to roll this out for our HEDIS and risk adjustment, as I stated, that's a continued focus for many payers and for many of us providers as well. Furthermore, I would like us to be able to roll out the same technology beyond those HEDIS and risk adjustment, as I had stated, and be able to do that for some of our other requests that we receive. If we can provide records in a more timely manner, it should help us to reduce any duplicate requests that we may be receiving. It should also help with the volume of status checks and calls that we receive. And through both of those, it should increase patient, provider, payer, and other third-party relationships. I see it as a win-win all the way around. I think too that as we see more regulations being passed, and you just stated one of those, which is the reproductive healthcare privacy regulation, we see that as being more complex. And certainly we're still trying to work through that one all ourselves and figure out what those workflows and those processes are going to look like. We also need to make sure that we're compliant with those. So if we can create other efficiencies in our workflows, then it enables us to then spend more time ensuring that we're compliant with regulations as well. I think we also need to find ways to reduce our touch points and the processing of medical records. So as I just said, we can ensure on meeting the intent of regulations, protecting our patient privacy, and doing anything we can to further decrease that turnaround time and get the information into the right hands within an appropriate time frame.
Yeah, thanks, Jamie. I agree. I think at the end of the day too, it's the overall experience too of who's getting the information, not just the patient. I think everybody's the customer, right? Who needs the information.
Yeah, definitely. I totally agree with you.
For the correct purpose. So speaking of automation, and I think it's an exciting time, and I'm sure you're going to be excited to really watch and see all of this come to life and actually realize the efficiencies and see wow, this all does really work. What are some other automation tools and solutions, are you working on or implementing now?
I am more than happy to share that information with you because we have an amazing intelligent automation team at Banner Health. And I know some of your listeners have probably heard me speak about our team in the past. So right now we have 18 different robotic processes, or we refer to them as bots, in production or slated for deployment very soon. And those bots are very specifically for our HIM team, or they work in tandem with other processes that impact our team. So some of the examples include a bot that renames incoming electronic faxes and then moves them to the correct team to process. We have another that migrates documents from legacy EMR systems into the repository that we maintain all of those for retention and release of information. So that means we aren't having to keep those legacy EMR systems live. We can keep that information in a different repository, making it easier for our staff or others to locate the information. We also have another bot for auditing encounters for the presence and timeliness of required provider documentation. And we have one that also creates phone encounters for external documentation when it may be appropriate. Those are just a few examples of some of the different bots that our IA team has helped us to create. We also have a couple of health information professionals that are now working with our IA team to build other smaller custom processes. So this is something that the IA team just started this year. They asked us to nominate a few automation champions within our team. And I think HIM was one of the few teams that they actually opened this to. So that was very exciting for me. We have one of our HIM team members who recently created a hub for our release of information staff. So they have one place to go, kind of a one-stop shop, so to speak, where they can find multiple resources. They have a link for MRO's Exchange Manager. They have links for our most often used policies and procedures, department announcements, and commonly used forms and templates, just to name a few of the things that are out there on that hub. We're now working on other hubs for other areas in HIM. So, for our data integrity team, for our document imaging team, we want to be able to add KPI data to that so that we can see at a glance where we may have areas of opportunity across our different teams. And I think, thinking about today and everything that's going on within my organization today due to the CrowdStrike event, knowing that we have this automation in place gives me a little bit more of a sense of relief that once everything is back up and running again, these automation processes will help us so that, if I thought about it in the past, there was so much more that my team had to manually touch. And now I know that those bots are going to be able to handle some of that. So our recovery work is just a little bit easier. Maybe not easy, but a little bit easier.
Well, clearly, I mean, I don't know how you keep up with it all, Jami, but I mean, kudos to you. And I, wish you much success, which I know you will. And I'm so excited to see the outcomes. So, with all our talk around this all this automation stuff, I mean, it's clearly not going away, right? There are so many use cases out there today to help streamline workflows and processes. So as HIM professionals, what are some technologies and solutions do you think we can tell other professionals to keep their eye on as they look to implement, automation and all the different technologies in the future, to optimize their outcomes?
Angela, I would definitely say, for other HIM professionals, I am happy to talk, more one-on-one even about some of the things that we've done here at Banner, but very specifically around some of the tools and solutions that we're using through MRO. One of those is the auto-assisted logging, or we refer to it as AAL. And that is a newer solution through MRO that helps us through our release of information processes. So just very simply, that technology will read an incoming request for medical records, and it will log the request into MRO's Exchange Manager. We will have staff members who will go behind to make sure that what got logged is HIPAA compliant, that we've got everything in the right fields, and that we have a HIPAA compliant authorization in place as well. However, what it does for us is reduces the manual time to log that request. And as I just said, it allows staff more time to review for other compliance pieces related to that request. And importantly, it allows us to be able to move staff over to actually processing the request so that we can get that medical record out to the requester in a more timely manner. Another one that we're looking at is audit manager software through MRO. As we all know, audits and clinical denials can be a very painful part of our revenue cycle process. As HIM professionals, we need a way to clearly monitor the financial impact, payer integrity, process appeals, and identify root causes. So partnering with a company that allows us to efficiently manage all payer audits and clinical denials with robust workflow automation, hospital integration, and collaboration tools, it's definitely much easier to manage those audits through the various stages, and we can do so simultaneously and in one platform. We're also talking to MRO about disability informed completion solutions. So this one was a fairly new one for me, and I was really excited to take it forward to some of our other clinical teams within Banner. So partnering with an organization for the completion of FMLA paperwork, disability, insurance claim forms, instead of having our doctors and nurses fill out these forms, they can get back to patient care, which is truly what matters and is meaningful. The right partner, such as MRO, can automatically access patient information within the EHR system, and they can accurately complete those patient forms and handle all of the patient communication for us. Again, these are just some of the different solutions that we've looked at, but I highly recommend that other organizations check out different solutions that may augment the processes within their own organizations.
Thanks, Jamie. I couldn't agree more. I gave a presentation earlier this week, and I said, if you're not talking about automation, if you're not implementing automation, if you're not really like discussing an implementation plan or a plan to bring it to life, you're behind. And I just think if you're not on that bandwagon, you have to be on that bandwagon, because that's where, we're going. It'd be like, think about 10 years ago, 20 years ago, when we were like, EMRs is the wave of the future. That's where it's going. Like, you're either going to be there or you're not. And look at where we are now.
I've definitely heard staff say over the years that they can't imagine where we would be without an EMR. So I would have to say they're going to say those same things about this automation in the future.
Right. Agreed. All right. Last question before so I don't take up too much of your time today. So we know that, the automation, and you're going through all of it right now. There's not just the implementation, there's also the change of workflows and the change management and training, education, all of that stuff. So it's a significant change, and significant changes can be met with resistance sometimes, right? Especially up front, might be a little bit nervous, like, what are we doing? How are we going to do this? What has been the direct impact on your team, specifically when you think about, getting staff buy-in, reactions to it? Because all of that helps to shape a project, make it stronger, help you make your team to realize, wow, this is going to really make us, a faster team or a better team, or, to ultimately improve those outcomes. So what has been some of the direct impacts to your team?
Angela, change is always hard, to sound a little cliche. And I am a person who likes change, but it can still be hard for me too. So someone recently made a comment that really stuck with me, that we need to be able to embrace change, that accepting change is very different and it can still lead to resistance. So one of the things that I've learned over the last couple of years is that we really need to focus on helping our staff to understand the reason and the why behind automation, why it's important, how it can impact us. We need to be able to tell the story, help them to understand the intent of the automation, that it's there to augment our processes, and that allows our staff to focus on more complex and meaningful tasks. We've had moments that we didn't do that so well, and we learned from it. And like I said, I had to learn from it as well. So now we're being more intentional. We need to also be able to be open to hearing the feedback from our staff and the concerns from those who are doing the work daily. They're the experts in this. They may identify an issue long before a leader does. So from my perspective, ensuring that we have staff who are going, once that maybe the automation is designed, making sure that we have the staff who are in the trenches doing the work every day are actually part of the same team who's doing the testing as well, and that they're finding any of those areas that we have to improve the automation before it actually goes live. So, all of that together, I think, is what has helped us to have a more successful implementation. I do feel it also helps us to build stronger teams through all of that collaboration. And through all of that, we should definitely see positive results from the automation that we implement.
Well, thank you, Jamie. Like I said, I couldn't agree with you more. I've had such a pleasure talking with you today. I think we're both pretty passionate when it comes to the automation piece. And I think because seeing some of the realizations of it and seeing what it really can actually do, like once you actually see it functioning and working, it's just, I don't know, to me, it's probably one of my favorite parts of my career so far because it's just so cool. Well, I don't want to take up any more time today. I want to thank you, Jamie, for being my guest today and being a part of our show. I always love working with you. So with that, I'm going to end our time together. I want to say goodbye to everybody and for you to have a great day, Jamie.
Thank you, Angela. I always love working with you and appreciate the opportunity.
You've been listening to the MRO Exchange, where we connect healthcare execs. For more insights and to hear other healthcare executives' exchanges, visit the show's page on mrocorp.com and be sure to explore additional resources and thought leadership articles. You can also check out the program page on healthcarenowradio.com. Finally, be sure to connect with us on LinkedIn or X at MRO Corp. Until we talk again, this is the MRO Exchange, where healthcare execs connect.